In this chapter, we're going to start learning the names of the muscles of the body. We're going to start with the axial muscles, and then we'll move to the appendicular muscles in the next chapter. We're going to start with the muscles of the face, because as you might imagine, with all the expressions you can make, there's a lot of muscles on your face. It seems really complicated. Don't freak out. It's not that hard. Okay. They all originate either on the superficial fascia or the skull bones. And they insert into the superficial fascia, so they pull on the skin to move the skin to make expressions. The first one we're going to learn is the Occipital Frontalis. It's actually a two-part muscle connected by an aponeurosis. You remember, an aponeurosis is a wide, flat band of tendon. So the Occipital Frontalis has two bellies. A belly is a part of a muscle. Okay, it's just a term that people use. So the frontalis is the frontal belly, the occipitalis is the occipital belly, and together those two plus the epicranial aponeurosis make up this whole muscle that goes across the top of your head called the occipitofrontalis. When you contract the occipitofrontalis muscle, you raise your eyebrows, and it makes horizontal creases across your forehead. Okay, so you can, if I say what's this called, you could call it either the frontalis or the frontal belly of the occipitalis. Either of those would be fine. Now, for the rest of the muscles, almost without, well, with very few exceptions, they are named for what they do and what they do it to. If it raises something up, it's a levator muscle. If it pulls something down, it's a depressor muscle. If it's a round muscle, it's called an orbicularis. Okay? It's an orbit. It goes around in orbit. Get it? Okay, and then it's what it does it to. The mouth is the oral cavity, so whatever it is an oris. Okay, it's a something oris. So the round muscle that goes around your lips is called the orbicularis auras. Okay, round muscle around your lips. It's actually a sphincter muscle. The upper eyelid is called the Papillary Superioris. Palpably means lid. Superioris, in this case, refers to the upper eyelid. Okay, it's describing eyelid, not the muscle. So this is where some people get confused because they think, well, we've got an superioris, there has to be an inferioris. There actually isn't, because the lower eyelid doesn't have independent control. The Levator, Papillary Superioris, is going to raise the upper eyelid. There is no depressor Papillary Superioris because the eye is closed and that eyelid is brought back down by the Orbicularis Oculi, ocule meaning eye. Okay, so that's what this means. Not every muscle has a direct antagonist. Okay, so not every levator has a corresponding depressor. Okay, so that's the confusing thing, but if you keep this naming convention in mind, then everything is going to make sense. Okay, the lips, the upper lip is the Labii Superioris, the bottom lip Labii Inferioris. So the levator Labii Superioris pulls the upper lip up. There is no depressor labii in Labii Superioris because the lip is pulled down by the Orbicularis Auras. The Orbicularis Auras is the antagonist to the muscles that pull the lips, the upper lip up or the lower lip down. Okay, so we have levator Labii Superioris and depressor Labii Inferioris. Okay, we're going to go over this, don't we? It'll make sense. The corners of the mouth are the Anguli oris. So we have a depressor Anguli oris that pulls down on the corner of the mouth and makes those awesome frown lines. All right. Now, Corrugator Supercilia. I know you're thinking, wait, you just said what it does it to. What is this? Well, supercilia, you remember there is a superciliary arch where your eyebrows go? Well, the corrugator superciliary eye creates corrugations or wrinkles between your eyebrows. So the corrugator supercilii is this tiny little muscle right here that makes these vertical creases between your eyebrows. Now, on these diagrams and on the diagrams for all of our muscles, that were all the things that we're going to do this week, they're going to be often 2 layers, sometimes more than 2 layers. And the way that your textbook has done it is that the left side is always superficial to the right side. And they're usually labeled superficial and deep. So here's the superficial layer of muscles, here's the deep layer of muscles, and here, this frontalis muscle here has been cut away so that we can see this corrugator supercilii, which sits completely deep to the frontalis muscle. Okay? So when you're looking at these diagrams, keep in mind what's superficial and what's deep, and then pay attention on the diagrams when it tells you that a muscle has been cut away to show you a deep muscle. Okay? All right, now, okay, this one, it doesn't have the same naming convention. The Procerus is this little muscle that goes along the bridge of your nose, right over the nasal bones. It goes vertically, and it makes these little horizontal lines across the bridge of your nose. So it pulls the bridge of your nose up toward your forehead. It's called the Procerus. Okay, that's that little muscle right there. Now the Nasalis goes across the bridge of the nose, across the cartilage part of the nose, and flares the nostrils out. So it pulls the nostrils out. This little girl's actually using her nasalis as well, creating these vertical wrinkles along the bridge of her nose. Okay, so the Procerus is creating these horizontal wrinkles. The nasalis creates those vertical wrinkles and flares the nostrils like that. Okay, that's the nasalis. All right, now here's a muscle that is on some of our diagrams, and it's sometimes mentioned, but I'm not actually going to ask you about it. I'm just going to tell you about it. I personally think that this muscle is a little selfish, using 5 words in its name, kind of hogging all the words, but no one asked me. Okay, so this is the Levator Labii Superioris Alecinesi. What is that? All right, Levator lifts up. Labii Superioris, what does that mean? Upper lip. So it's going to lift the upper lip. Well, what's this other part? Nasi refers to the nose, nasal. Alechi means next to. So it's this thin muscle that runs along the side of the nose, inserts just below the nostrils, and it helps to make a sneer. Okay, so it's going to lift the upper lip and lift the lateral edge of the nose. Okay, so that's that. I won't ask you about it. Now, Levator Papillary Superioris, like I said, raises the eyelid. It sits deep to this muscle which opens the eye. Sorry, which closes the eye. I forgot what I was saying. The Levator Papillary Superioris opens the upper eyelid. The Orbicularis Auras is the antagonist to it, and it's superficial. So this one is going to levate, raise, Papillary Superioris, the upper eyelid. The Orbicularis Oculi, did I say Orbicularis Auras back here? I probably did. It's Orbicularis Oculi. Okay, Orbicularis Oculi is this round muscle that goes around the eye. It is the antagonist to the Levator Papillary Superioris, and it closes the eye. If you do one, if you contract one of them, you wink. If you contract both of them, you blink. If you contract them really hard, you squeeze your eyes shut really hard. Now, the Orbicularis Auras is the round muscle that goes around the oral cavity, hence oris. So that's that. It is the antagonist to all of these muscles around the mouth. Okay, so we're going to have levators that pull the upper lip up. We're going to have muscles that pull the corner of the mouth out and down. We're going to have depressors that pull the lower lip down. And none of those are going to have antagonists with the opposite name, because the antagonist to all of them is the Orbicularis Auras. Okay, so this is the one that closes your mouth, puckers your lips for a kiss, or a Zoolander face. Now, the depressors. Depressor Labii inferioris. What does it do? It pulls down the lower lip. So in this case, Labii inferioris refers to the lower lip. So this is this wide band of muscle here that goes from the lip to kind of laterally, a little bit down and lateral toward the mandible. It originates on the mandible and it inserts on the lip. Notice this is not the one that goes from the corner. That's a separate muscle. And it's definitely not this one that goes to the mental protuberance. That's a separate muscle. Okay, it's this one. So it pulls the side of the bottom of the lip down. The depressor Anguli oris is this one that goes from the anguli or angle oris of the mouth. So it originates on the corner and pulls down. So if you just look at the muscle, look at where is it inserting, and remember what it does and what it does it to. So this one goes from the mandible to the corner of the mouth. It can't lift up because it can't push. It has to pull. So it has to pull down. What is it pulling down on? The corner of the mouth. What's the corner? It's an angle. Remember on the bones we had angles at the corners? So this is the depressor Anguli oris. Now, the levators. The levator Labii Superioris, much like the one with the long name, is going to pull up on the upper lip. It pulls the upper lip up toward the orbit. Okay? This is not a smile muscle. It's making the sneer. Okay? It's pulling the side of the upper lip up toward the eye. It's cut here so we can see the muscle under it. We'll talk about that in a minute. So this is the levator Labii Superioris. Deep to that one is the levator Anguli oris. Okay, so it's shown, a little part of it is shown here. So here's the levator Labii Superioris. This is the levator Anguli oris. This is one that's going to pull the corners of the mouth up toward the orbit. Okay, this is kind of a, like, if you do like a fake, not like a half smile, but like a fake smile, pained smile, you're going to use your levator Anguli oris. This is not seen on this superficial diagram, but on most of our models because it's deep to the levator Labii Superioris. Okay, so that's one thing. Now, the smile muscles that pull the corners of your mouth towards your ears are called the zygomaticus. Guess where they originate? On the zygomatic bones. See, now it all makes sense. All right, we have a zygomaticus minor and a zygomaticus major. The zygomaticus major originates at the corner of the mouth. The minor originates superficial to the levator Labii Superioris, kind of in the middle of the mouth, of the upper lip. Okay, now here is a way to remember which one is the major and the minor, because let's face it, the minor isn't that much smaller than the major in this case. But except in one instance, we're going to have several pairs of major and minor, and the minor is always above the major. If you remember that a minor is a child and a major is an adult, then the minor sits on the major's shoulders, like the child sits on the adult's shoulders. Get it? Okay, so that's your zygomaticus major, zygomaticus minor. They both insert on the zygomatic bone and pull your mouth toward your cheeks for a real smile. Now the risorius pulls the corner of your mouth laterally for that half smile, okay? And it's here. Now, in some diagrams and models, it's straight. In some, it's curved. It's kind of hard to tell. Same with the zygomaticus. Sometimes they're straight, sometimes they're curved. You just got to be aware of that. But this is a superficial muscle that goes across and pulls the corner of the mouth toward the ear, okay, more horizontally. That's the risorius. All right, so here is a sculpture. Let's name all of the muscles that we can name. So go ahead and pause the video if you want, right here, and then when you restart, I will name all of these. Okay, so here we go. The muscle that goes this way and makes horizontal lines on your forehead, that's your frontalis, or the frontal belly of the Occipital Frontalis. Deep to that, here and here, Corrugator Supercilia. Here, Procerus. Across the nose, Nasalis. Here we have Levator Labii Superioris going under the Orbicularis Oculi. Under that, right there, you can see the, here it is, there it is, the Levator Anguli oris. Here we have zygomaticus minor, zygomaticus major. Notice they both insert on the zygomatic bone. risorius, there, going horizontally. Depressor anguli oris, pulling toward the mandible. Depressor labii inferioris, there. Cool, right? All right, couple more. Mentalis. This is the mentalis. It originates on the mental protuberance and inserts on and just below the lower lip, and it pulls the lower lip toward the chin to do this adorable little pouty thing. Okay, so that's your mentalis muscle. There it is right there. Don't confuse it with the depressor labii inferioris or the depressor anguli oris. Okay, so we've got 3 in a row there. Depressor anguli oris, depressor labii inferioris, and then mentalis. Now the platysma is a superficial muscle that covers all of these other muscles of the neck and flexes when you do the weird thing there, okay? And it's honestly not on most of our models because it covers up all the other muscles that we want to look at. So it is visible in diagrams, but that's all. All right, so here is one of our best head models so we can see all of these muscles. So here is the Orbicularis Oculi and the Frontalis, okay? Here we have the Levator Labii Alicanaesi. The zygomaticus minor is here. The zygomaticus major is there. Notice they're a little farther apart than they were in the diagram. That's okay. Remember, there's a lot of individual variations. This is the risorius here, depressor anguli oris. This going deep here from the mouth to the orbit is the Levator Labii Superioris. This model, you cannot see the Levator anguli oris. This is the Orbicularis Auras. This is the depressor labii inferioris, and then you can kind of see the mentalis there. Oop, I forgot the nasalis. You can see the nasalis going across there. Okay, so those are all the ones you've learned so far. In the next part, we're going to learn the muscles that move the eye, the jaw, and the tongue.